Hello, my name is Brook Ward. I'm the President CEO of the Washington Health System. It's my honor to be back with you again as we attempt to give you updates about what's going on in the world around us and within the walls of the Washington Health System. Before I get to my normal updates, I want to take a few moments to reflect on the events that took place in our nation's capital earlier this week. We're actually recording this video on Thursday, January 7th, and we'll post it on our social media channels Friday, January 8th. And I hope we have no additional events like we saw earlier this week take place from the time we recorded this to the time we post it, or frankly, even afterwards. We've all had a rough few years, and the last 10 months have been worse with the worldwide health crisis that we've all been dealing with. I share with you that I'm personally been stressed, tired, worried, and burned out as we as a health system had to deal with the COVID pandemic that's taken place and everything we've had to do to accomplish and take care of that for our community. In addition to that, we've been tasked with trying to vaccinate our communities in Washington, Greene County with limited or no resources, which has not helped our stress and our resources. But after watching the events that took place this week, I've decided I'm not going to let those events darken my mood or destroy my morale. In fact, I'm here and I'm going to make a personal choice towards the opposite direction. I'm choosing to re-energize, re-engage, and remain positive going forward. So I'm here today publicly to reaffirm to you that I'm going to provide the best leadership I can to the Washington Health System and help make sure our organization provides great patient care to each and every one of you every day. In addition, to help take a leadership and coordination role in trying to get our entire community vaccinated as quickly as possible so that we can all get back to normal life. Lastly, I hope you'll join me in stepping forward in a positive way in any way you can to help our community and our nation. Now let me move on to our normal updates, and most of which are related to COVID, but I do have one exciting thing to share with you that doesn't have anything to do with COVID, and that is a congratulations to our physicians and our staff who work in our labor and delivery unit, our OB labor and delivery unit. This is the Washington Health System Care Center for Family Birth. The staff and the physicians in that area have helped us achieve the Healthgrades 2020 Labor and Delivery Excellence Award. This is an award that's given to the top 10% of hospitals across the entire nation for quality of care provided to women who had deliveries at these hospitals. In addition to receiving this award, we completed a multi-million-dollar renovation of the labor and delivery unit this year that was completed in the middle of the pandemic. This labor and delivery unit is on the 5th floor of the Washington Hospital, and it's called the Care Center for Family Birth and Women's Health. It includes 13 private postpartum and recovery rooms for OB and gynae patients. In addition, the birthing center includes 5 labor and delivery rooms, surgical suites, and then the nursery, which includes a level 2 special care unit for those infants who need that special attention. So we're excited not only about the renovation, but this Healthgrades Award distinguishing the great care we're giving to our community. Thank you to all the physicians and staff who work in that area. I appreciate that. Now moving on to COVID. We in the state of Pennsylvania are just coming out of some of the most recent COVID restrictions. There's still many restrictions in place, but we need to remain diligent. Just because some of the restrictions have gone away, we need to continue to use social distancing, hand hygiene, wearing a mask. All those things are important. Here's why. As of Monday this week, we've had over 20.6 million Americans affected with COVID-19 since the beginning, with 1.5 million infected in the last week alone. There are over 128,000 people this week, Monday, they were hospitalized due to COVID-19. And there was a record number of people in the state of Pennsylvania with over 5,500 people hospitalized for COVID, with 1,150 people in ICUs. So we need to remain diligent, careful, and safe. We can't, again, let our guard down. Now, the COVID inpatient numbers at the Washington Health System are actually down, thankfully. We're about half of where we were at our high back in November. But we're the anomaly, we're the exception. I know from talking to leaders and hospital employees at hospitals in the east, south, and west of us, they are all being overrun and are being tapped tremendously. And I cannot explain why they're seeing higher numbers of cases 20 and 30 miles away versus what we have here. But we'll take the reprieve, but we don't want those numbers to go up. So please remain safe, keep your guard up, do everything you can to prevent the spread of the infection. Now I want to move on to another new exciting news in the treatment of COVID-19. In November of this year, the U.S. Food and Drug Administration gave emergency use authorization to 3 drugs that are all considered monoclonal antibody therapies. This therapy was set up and approved for people who have a COVID positive test, over the age of 12, greater than 88 pounds, and who have a severe risk of becoming severely ill with COVID-19 and or needing hospitalization. These monoclonal antibodies basically essentially are laboratory-created proteins that help mimic the body's immune system ability to fight off harmful antigens, including viruses. These antibodies are specifically designed to help attach to the spike protein on SARS-CoV-2, designed to block the virus's ability to attach and enter human cells. The treatment must be administered on an outpatient basis within 7 to 10 days of the onset of COVID symptoms, and it helps prevent the likelihood of someone being hospitalized and being severely ill. This is a great advancement in care, and we're happy to bring it to our community. Matter of fact, we're excited to bring this cutting-edge therapy to the Washington Health System and our communities of Washington Green. We started doing this treatment for patients on December 21st. We've done 20 patients so far who have had a great outcome. So again, we're excited to bring this here and help prevent people needing to be hospitalized due to getting COVID-19. I've also gotten a lot of questions about COVID variants that are taking place and emerging around the world, particularly the one out of the United Kingdom, which seems to be the most prevalent in the news right now, and it has the largest number of mutations of all the variants. Now, it appears to be more contagious and spread more easily among humans, although it doesn't appear to create any more severe illness or increased risk of death. So we don't know a lot yet about them. We'll continue to monitor that situation, but the good news is the commercially available COVID vaccines appear to work in preventing the spread of that. That's the good news. So we'll continue to monitor it, and more to come on that in the future. Let me take a few minutes to talk about the COVID-19 vaccines. We at the Washington Health System received our first delivery of vaccines in late December. And in the last 8 days of the month when we got the vaccine, we vaccinated over 1,600 people. And as of Friday, the day we're posting this video, we will have used up all 2,300 doses we received. All of those going to healthcare employees, both people that work for us and people in the community who don't. Now, we're going to be getting another delivery of vaccine next week that is meant for those people to get their second dose, particularly the people that got it from us early on. We don't know yet whether we're going to get enough vaccine to do additional people and start their first dose. We hope that's true, but we don't know whether that's going to happen yet or not at this point. Now, I've been asked by quite a few people, are we on track to help get the community to herd immunity? And I don't know the answer to that because I'm not sure what on track means. If our target is to get enough people vaccinated by June, the answer is no. So we've done the math on this, looking at the number of people in Washington and Greene County. It would take us giving 8,000 doses every week between now and September until we can even get to that level. So I think the short answer is we're not on track, and we also have two important limitations that are going to prevent us from speeding this along. And they are this. One, how many vaccines can we get? We're not even getting delivery yet close to the 8,000 per week we would need. And frankly, if we want to be done by June, we'd have to get more than 8,000 per week. So we're not getting that much vaccine delivered to us, and I don't know if we ever will. Secondarily, the restriction is people. All of our people are focused on taking care of inpatients who are being admitted due to COVID and other reasons, and outpatients. We don't have people sitting around to set up vaccination clinics. So we're doing the best we can. We're getting through it as quickly as possible. We're going to need help. And because of that, the Washington Health System, myself personally included, have been working with Mon Valley Hospital, Centerville Clinics, Cornerstone Care, Washington and Greene County commissioners and other officials to help create a consolidated Washington and Greene County vaccination plan that we're all going to work on together to help get this done as quickly as possible. This plan lays out which groups, employers, and others are going to get the vaccine in which order and how we're going to accomplish it. I'm very appreciative to the folks at all those entities to help work together with us to help create this plan so we can get this done as efficiently as possible. But it's going to take some time. It might take months before we get to you. And so my request to you is to remain patient. Please know we're going to get to you as quickly as possible. You can help us by stop calling, texting, and emailing, asking when you can get the vaccine. It's going to be a while, but it's taking time for us to respond and get back to you, and that's actually creating a burden on our system. So please hold back, be patient, and we'll get to you as quickly as we can. In the meantime, we're happy to get this rolling, and we'll work on getting it done for our community as quickly as we can. In addition, on top of that, we need you to remain diligent. Because it's going to take some time, and even after you get the vaccine, we need you to continue to wear a mask, hand hygiene, social distance, do all those things that are important. If you're a patient of one of our employed physician practices, remember we have the 2 respiratory clinics set up for you if you have COVID or flu-like symptoms. one in Washington, one in Greene County. That way you can go there to get treatment, remain safe, and that'll help protect our staff and physicians as well. We also continue to do COVID testing at the Wellness Way here in Washington County and down at Washington Health System Greene in Greene County if you need a COVID test. And lastly, our limited visiting hours remain in place at both hospitals where we're not allowing any visitation at this point to keep patients and our staff safe. Lastly, I want to just take a moment to thank the Washington Health System team members. Each and every one of them have done a tremendous job taking care of our community and our patients. COVID fatigue is real, but each and every one of them have persevered day in and day out to make sure we continue to provide great patient care to each and every one of you, and I want to thank them publicly. And if you want to send them thanks, you can send a thank you to an individual or to a group by going to our website, whs.org/thanks, and leave a note that we'll pass on to them. Lastly, I want to just thank you for your time and attendance. I hope you found this information useful. I'll be back again for our next video on Friday, January 22nd. Until then, stay safe.